Hello, today I'll be discussing one of the deadliest viral diseases known to humankind, Ebola. This presentation will provide an overview of the Ebola virus, its origins, the impacts of its outbreaks, and the crisis management strategies used to combat it. Understanding Ebola is critical not only for the regions directly affected, but also the global health security. What is Ebola? Ebola virus disease, or EVD, is a severe, often fatal illness caused by the Ebola virus. First identified in 1976 near the Ebola River in the Democratic Republic of Congo. This virus is notorious for its high fertility rates. The disease spreads through directly contact with bodily fluids of an infected person and is known for causing fever, muscle pain, and severe hemorrhage in its advanced stages. Some background information about Ebola. One of the most devastating Ebola outbreaks occurred between 2014 and 2016 in West Africa, resulting in over 11,000 deaths. The outbreak overwhelmed healthcare systems, led to widespread fear, and significant economic consequences. The rapid spread of the virus exposed weaknesses in healthcare infrastructure and emergency responses. Causes of the Ebola virus. Ebola outbreaks are primarily caused by natural recessors. The virus is believed to originate from fruit bats, which spread it to other animals and humans. Human-to-human transmission, which is direct contact with infected bodily fluids, contaminated surfaces, and medical equipment facilities. Rapid spread. Weak healthcare systems, shortages of trained professionals, and delay in outbreak response worsen the crisis. Some key events. In 1976, the Ebola virus was discovered. Through 2014 and 2016, the largest record outbreak occurred in West Africa, leading to a global public health emergency. Recent years, isolated outbreaks continue to emerge, highlighting the ongoing risk of Ebola and the need for substance vigilance. Is it a crisis? Ebola is undoubtedly a crisis of a high fatality rate, ranging from 25% to 90%, depending on the outbreak and response. Its rapid transmission, communities with poor healthcare access. Its economic and social impact, which outbreaks disrupt economies, restrict travel, and cause social unrest. Its global significance. Due to international travel and trade, there is always a risk of cross-border spread. Ebola represents different types of crisis. Healthcare crisis, due to the strain on medical resources and personnel. Humanitarian crisis, affected communities face severe suffering, stigmatization, and fear. Leadership and risk management failure, delayed response, misinformation, and inadequate preparedness. Was the crisis managed efficiently? Despite improvements in vaccine development and response strategies, Ebola management has faced significant challenges. Infrastructure gaps. Many outbreak regions lack necessary healthcare facilities. Misinformation and community distrust. Some communities resist interventions due to cultural beliefs or fear of authorities. Response delays have slowed crisis response in several outbreaks. What did we learn? From past outbreaks, we have learned that early detection and rapid response are key. Delay leads to severe outbreaks. Community engagement is essential. Effective education and trust building improve response efforts. Healthcare investments must continue. Strengthening infrastructure and research is necessary to prevent future outbreaks. Global impact and response. The global response to Ebola has shaped international health policies. 2014 through 2016 outbreaks triggered improved global health care security frameworks. Countries are now more prepared for pandemics. Vaccine advancements. New vaccines have significantly improved efforts. Crisis condition. International organizations like WHO or CDC have refined their outbreaks response protocol. Before we conclude, here are some thoughtful, provoking questions to consider. How can global health regulations be strengthened to ensure better outbreak management? How can we integrate cultural beliefs into public health strategies without compromising safety? Do we ensure that lessons from Ebola are applied to future health care crisis? Communication techniques. During an outbreak, communication plays a crucial role. Transparency. Providing accurate information prevents panic and misinformation. Community involvement. Engaging local leaders and residents ensures cooperation. Consistent messaging. Governments, health organizations, and media must align their information to avoid confusion. In conclusion, Ebola is a serious health threat with global implications. While we have made progress in managing outbreaks, challenges remain. Strengthening healthcare systems, improving communications, and maintaining global cooperation will be key to handling future crises efficiently.